Hello class, today we are going to be doing an assessment comparison analysis on VB MAP versus PEAK assessment. The presenters for today will be Logan Stripling, Taylor White, Megan Jenkins, Ashley Romero, and Shayna Bazella.
The client in this case is a 3-year-old female. She has no spoken words and mainly uses hand leading for communication. She received her ASD diagnosis in 2023 at age 2. Some of her strengths include independent play, gross motor imitation, and independent daily living skills. Her deficits mainly lie in the communication area, with manding, tacting, and echoics being her highest deficits, along with following instructions, group play, and prompt dependency.
Promoting Emergence of Advanced Knowledge, known as PEAK, is an evidence-based assessment with corresponding curriculum that assesses language, cognitive abilities, problem-solving, and critical thinking. The age range for PEAK is 18 months through the teenage years. There are 4 modules: direct training, generalization, equivalence, and transformation. Each skill is directly assessed in 10 trial blocks. A score of 80% or higher is needed in order for a skill to be considered mastered. The limitations are it can be done in less than 2 hours, it's designed specifically for children with autism, and results are only effective as the implementer. Direct training measurement is utilized when conducting a PEAK assessment. The data collection procedures for PEAK include a fillable PDF that is available on the PEAK website to make data collection easy. The validity and reliability of PEAK is generally seen as a scientific method of assessment. The utility in selecting this intervention can be used to support language skills, flexible thinking, and perseverance. It has been shown to be able to be implemented in schools without extensive training. PEAK also provides comprehensive assessment across a wider range of language skills.
Verbal Behavior Milestones Assessment and Placement Program, also known as VB MAP, is an assessment and curriculum planning guide tool. This assessment is used with children diagnosed with autism as well as children with significant communication delays. The assessment is split into 3 developmental levels: 0 to 18 months, 18 to 30 months, and 30 to 48 months. There are 170 measurable learning and language milestones. Level 1 of the assessment contains the evaluation of early man, tact, and independent play. Level 2 contains continued evaluation of Level 1 skills as well as intraverbals and linguistic skills. Level 3 expands on the skills of Level 2 as well as pre-academic behaviors in reading, math, and writing. The VB MAP is completed through direct testing, observations, or a combination of both. When scoring the VB MAP, there are 5 skills that fall within each operand. These skills are scored using a point system of 0, 1, and 2. The total of the 5 skills are then added to the assessment score at the top of each section. The score is then translated to an assessment grid, which gives a quick look at the level the student is learning in. It also shows areas where the student is lacking skills. Some of the limitations of the VB MAP are that it can take a long time to get through the entire assessment. There are a lot of subsections, so it's recommended to go through the assessment prior to sitting with the student or client and fill the skills that you know the student or client is already capable of doing. Another limitation is that it's only appropriate for ages of 0 to 48 months. Although research shows that the VB MAP is a reliable assessment, it's important to use it in conjunction with other assessment tools in clinical judgment.
The assessment that we chose to best fit this client was VB MAP, which is commonly used with early learners such as her. The learner has deficits in various different areas of learning, and the VB MAP breaks down these skills into different domains at a pace that works for the client. Since the learner has deficits in communication and is non-speaking, the VB MAP can assess which type of communication will best suit her. Concerning social skills, she can engage in independent play but struggles to engage with other children. The VB MAP assesses independent and social play skills separately, allowing the assessor to identify the specific needs for the client. The learner also engages in multiple forms of maladaptive behavior, which the VB MAP can assess through the barriers portion of the assessment. The VB MAP aims to help decrease the number of barriers as the repertoire of skills increase.
Testing and observation will occur in a clinical setting with no strict time limits, as administration time will vary depending on the client. At the conclusion of the assessment, results will be analyzed, strengths and deficits will be identified, and the skills needed for intervention will be determined. The next steps will involve the BCBA establishing specific measurable goals targeting the identified strengths and deficits, selecting interventions based on the individualized skill needs using evidence-based practices, and finally, the BCBA will regularly monitor progress towards goals and adjust interventions as needed.